Okay, great. Well, for those of you who are here, if you could scan the QR code that's on the screen to sign in, that would be great. I'll send you a follow-up email later this week with some more resources and additional contact information. So definitely fill that out so that we have your contact and you also know how to contact us. But again, thank you so much for the introduction. I appreciate it. So um, I am here with some other medical students, so I'll have them introduce themselves. But my name is Sarah Morgan. I'm the admissions counselor for outreach and recruitment at Rush Medical College. And two medical students are here to join me today. We have two preclinical students. And so if you all could introduce yourself by sharing your name, your year, where you're from, and where you went to undergrad. And you can also share a little bit about what you did after undergrad before medical school if you'd like to. Morgan, do you want to start us off for introductions?
Yeah, sure. Hi, everyone. My name is Morgan Regner. I'm originally from Denver, Colorado, but I went to undergrad at Michigan State. And then knew you guys. I actually did a gap year at the NIH in Bethesda, Maryland. So I know like this much about Maryland, but that's okay. And shoot, is that everything? I think that was everything. All right, Audrey, you want to go?
Yeah, hi guys. I'm Audrey. I'm actually from the suburbs of Baltimore, Maryland. I'm from Ellicott City, Maryland. I went to the University of Maryland College Park, graduated in 2023. And similarly to Morgan, I did do the post-bac fellowship program at the NIH, and I did that for 2 years before starting medical school this year. So I'm a first-year medical student.
Hey, great. Thank you all so much. I will ask the medical students throughout to add a little bit in terms of a student perspective about certain topics. But we'll go ahead and get started. Again, I just want to remind people if you just joined, if you could scan the QR code and sign in, that would be great. And then also, if you could put in the chat what year you are at Johns Hopkins. So if you're an undergrad, what year you are, or if you're in post-bac. If you could just share that information so I know a little bit about the group, that would be great. And so feel free to send that in the chat as we move forward with the presentation. But we'll go ahead and start with the first part of the presentation, which is all about Rush Medical College, but also the university and the medical center as well. And then after we talk about all things Rush, then we'll talk about our admissions process and the application cycle and all of that. So, okay, great. So people are sending responses. Okay, so we have seniors, juniors, sophomores, post-bac. Okay. Okay, great. Alumnus. Okay. So we have a current cycle applicant. Okay, great. Um, okay, great. Awesome. Well, it's good to see people here from all different stages of the pre-med cycle. So thank you all for sharing that. And if you're a current applicant, then maybe that admissions portion won't be as useful for you, but we're happy to answer any questions that you have throughout. Before we move on, I want to ask our medical students briefly why they chose to attend Rush for medical school, and whoever would like to start can start.
I can start real quick. So this may sound really planned out because you're at one of the admissions meetings, but I actually scheduled a tour with the admissions department with my club from Michigan State, and we came to Rush, we came to Chicago, got to tour the school, and like that like really solidified like, oh my gosh, I need to apply to this school. I really want to go there. It was mainly the students and how they like interacted with each other. I was really looking for like a group of students that was friends and they were all kind of like getting through medical school together. They all like knew each other. Everyone was kind of like working together. I wasn't really interested in one of those super competitive environments where people don't know each other as well. So I think just going on the tour and seeing the environment, seeing the student ambassadors who knew each other and like were friends and like just the culture at Rush, I think that's for me the most part of why I chose to come here.
Yeah, and I can add a little bit to that. Very similarly to Morgan, is very much so the people, and like the faculty and the students, but especially everyone has this common, I think Sarah will talk about it more, a very common commonality of loving community service and being really passionate about service. And that was definitely something I wanted in my medical education. And I think Rush does an amazing job with that, especially in Chicago. You're in such a diverse patient population and just learning so much and going out into communities and doing some service activities there. So definitely that was a huge part for in my decision of coming to Rush.
All right, great. Well, thank you both for sharing. The reason I ask is because I want to start us off with this video that is titled Why Rush University. So we're going to hear from people in the medical center and across the university why they chose Rush. But as you can see, even in the medical students' responses, there was even some overlap there. And I think that you'll find that a lot of people have similar yet personal reasons for choosing Rush. So we'll watch this quick video and then go on from there.
There's really something special about Rush. We have a rich history of individuals and teams living out our mission, caring for the communities that we serve, and leading in clinical excellence as a distinguished health sciences university. To support continued growth of our research and educational programs, we are searching for the best and brightest students, faculty, and staff to complement our clinical care, our community service, and our health equity mission.
Why Rush? Rush give back to the community.
I wanted someplace that felt like home, that modeled my values of diversity, equity, and inclusion. And that was one of the main things that screamed Rush when I was looking for schools.
I chose a program right here at Rush because of the amazing staff they had for during my delivery of my son and my daughter. They were an amazing team, and I wanted to be part of that team as well.
Rush values you not just as a student, they care very much about your future endeavors.
The people that I met on interview day were just so warm and welcoming, and then even just where Rush is located on the west side of Chicago and the patient population that we get to serve.
So if I had to describe Rush University in one word, it would be supportive.
Diverse,
Inclusive,
adaptability, major.
I would say family.
Excellence. Once you are inside Rush, they will make sure you excel in whatever you do.
I would say 2 words: improving health.
I didn't pick Rush, Rush picked me, and it gave me the tools necessary to be able to develop thanks to Rush.
I think the future is bright for Rush University as the cornerstone of a fully integrated academic healthcare system. Rush University will continue to invest in our people as our most precious asset, and will create a platform for them to train and to grow and to develop to provide care for the communities that we serve.
And I'm muted. Okay, thank you all. That was a quick video about why people choose Rush, but I also want to ask you all if you could, in the chat, just send a few words. If you were to answer the question, why Rush University, based on what was shared in that video, what would come to mind? So either something that popped up a lot or something that really stood out to you. If you could send in the chat your responses, I would appreciate that, just to get a good idea. Okay, culture was one word. Community, service, okay. Collaborative, service. Okay, I see a lot of service. Different backgrounds, community. Okay, great. So a lot of words, so a lot of similar themes that stood out to people, which is great because I think a lot of what you all mentioned, and thank you for sharing to those of you who did, I think what a lot of you mentioned is really tied to our mission. So as you can see, our mission is right here. And our mission is to improve the health of the individuals and diverse communities we serve through the integration of outstanding patient care, education, research, and community partnerships. So a lot of what you mentioned, so diversity was mentioned, community was mentioned, service, and that's all part of our mission. I know some of you are in the current cycle, and congratulations to those of you who are, but for those of you who have yet to apply and are still building that list of schools, I would recommend, and this might be an odd recommendation, maybe you haven't gotten this suggestion before, but I would recommend looking at medical school mission statements and see which mission statements align with your goals. So it's always good for you to consider not only the type of medicine you want to practice, but also who you want to be as a physician, what your values are, and how you want to apply that to treating patients. And then see if based on, which is, sometimes hard to tell, but based on that mission statement, is that a school that you believe would be able to help you become the future physician that you want to be? So for us, we already mentioned service is something that's important to us. So if that's also important to you, you'd be able to grow in that passion at Rush. But we also do have a emphasis on direct patient care as well, and caring for the diverse communities on the west side of Chicago. So if you have passion for that as well, you can grow in that at Rush. I think we are a school that really does walk the walk. We don't just talk the talk, which I think sometimes a mission statement is just a sentence, but for us, we really do live it. And I do also want to say that to clarify, one of the reasons we have service and patient care as such a big part of our mission is because we are located on the west side of Chicago, which for those of you, I know I saw someone in the chat mention that you're getting your master's in Chicago, so you might already be familiar with this, but we are in the west side. There are other areas of the city as well, like the north side, the south side, the downtown area, and then no east side because that's the beautiful Lake Michigan. But we are on the east or the west side. And the west side is underserved and under-resourced compared to some other areas of the city. So we not only want to give back through patient care, our patients are often coming from the west side, but we also want to give back to the community as a whole because we're here, we want to make it better and improve it, especially through things like dismantling barriers to health. And so another way that we emphasize that is we are an anchor institution. And for those of you unfamiliar with what an anchor institution is, it is basically an institution that supports the community through employment and purchasing power. And so yes, we want to improve the West Side through health, but one of the ways to also support the West Side is through providing jobs and investing in local employment opportunities. So for example, we have some more general examples here on screen, but some specific examples are we have a cafeteria in the academic center where our students who are currently here take class. And we have 2 different spaces in the cafeteria for local vendors from the community to come in and be featured as part of the menu options for that day for the hospital. And then we also do have a partnership with a launder on the west side of Chicago. So previously, we used to send our linens from the hospital across state lines, which you can imagine that might be expensive. It takes time. There's an ecological impact with, trucking things for many miles. And so we decided instead to partner with that launder on the west side of Chicago. And they are owned by people who live there. They employ people from the west side. And so we also are then able to spend the money that we would have spent sending the linens across state lines and invest that elsewhere in the community. And so that's just one example or a couple examples. And there are many more as well. But this anchor mission is kind of like a mini mission within our larger mission. Another one of those mini missions is health equity. And so some of you might be familiar with the term health equity. This is Dr. John Rich. He's the head of the Rush BMO Institute for Health Equity. So we won't watch this full video because it's a little bit longer, but you can watch the rest of it on YouTube if you'd like. But we're going to watch about the first minute to hear Dr. Rich talk about what health equity means for our mission and specifically on the west side of Chicago.
A child born today in downtown Chicago has a life expectancy of 80 years. But a child born 5 miles to the west in West Garfield Park has a life expectancy of 66 years. That is a 14-year life expectancy gap or death gap. And we know that public health and health together can help to close that gap. And so Rush has had for many years a deep commitment to eliminating that inequity that largely runs along racial lines. That is, the communities to the west are largely residents of color. Communities downtown are largely white communities. We see that we have a key role in closing that gap.
Okay, so that was John Rich. Again, as I mentioned before, he's the head of the Rush BMO Institute for Health Equity, which you can see right here is one of the ways that we strive towards health equity. So again, he talked primarily about the goal of us wanting health equity is to decrease the life expectancy gap or death gap between downtown and the west side of Chicago. It used to be 20 years, as he mentioned in the video, it is now 14. So doing better, but still not fully there yet. And so we have several ways where we try to address the barriers to health that people might face. We have a partnership with a group called Westside United. We also have on campus an Office of Community Health Equity and Engagement. I will also say you will not move through your time here as a student, a medical student at Rush, without learning about health equity and how to treat your patients equitably. That's a major part of our curriculum, and it's a huge emphasis for us. And so it is going to be a bigger part of the university and medical center as a whole, but also a priority of the medical college as well. So that's a little bit about us. Before we move on to the curriculum, if we have any questions, feel free to put them in the chat. But also I want to extend this time also for our medical students to add anything that you feel like is important before we move on. It's okay if not, but didn't want to miss anything.
I can just make a quick comment on kind of what that looks like exactly in our med school curriculum. So for an example, we have patient panels for each one of our blocks. So we have like a block curriculum. She'll talk about that later, but for each unit, we have a patient panel with patients from that community. So we do ones for those with physical disabilities. We had one for LGBTQ patients, a specific one for transgender patients. We had a veterans panel. So it's all of these different kind of communities that you will see as a physician in your future as a practitioner, but also you get to hear from the patients directly and how their experiences, and they are literally like members of the community that come to Rush for their care and have volunteered their time to come talk to us. So that's like one of the small ways that we talk about it, but those are my favorite, some of my favorite experiences.
Yeah, great. Well, since you previewed the curriculum, Morgan and Audrey, if you want to talk a little bit, since you're in this right now, if you want to talk a little bit about how the pre-clerkship curriculum is structured and what that entails.
Yeah, I can start. So yeah, I just started my first year, and in the preclinical years, which is your first and second year, you do a block-based curriculum that's organ-based. For example, like we just finished cardio, and now we're on pulmonology. And so it integrates both the normal and disease states into your learning, which is really fascinating. And we actually use a flipped classroom approach where we are given more time to self-study, and then when we go into class, it's more of a teamwork and team-based approach to patient cases. You're working one-on-one with physicians as your clinician educators, and working alongside a lot of your classmates to figure out these patient cases and apply the learning that you did outside of class. And Morgan, if you wanted to talk about the other two things.
Yeah, so along with those classes where you're talking about like the sciences and the that part of the curriculum, you're also doing like clinical skills classes. So like for example, during the cardio block, you then go down to the sim center, which is like a fake doctor's office where they have standardized patients, which are basically actors that work at Rush, and they pretend to be patients, and you get experience like interviewing them and seeing what's wrong with them, and also doing physical exams. So you're going to learn how to do a cardiac exam, abdominal exams. Like with each block that you're doing, you learn how to do the exam and what to look for, what would be wrong for kind of each of the diseases that we learn about. So you'll do that, as well as the last thing on there is explore. So that is each semester you're paired with a physician who volunteers their time. They volunteer to do this. So it's not like they're required to, they like actually want to be there. And you get paired with a physician. You can say, I'd like to explore anything, or you can say, oh, I'm really interested in surgery, or I really know I want to be in outpatient offices. Like you can literally tell them anything. And then you get paired with a physician, and you're supposed to shadow them for like, I think it's like 20 hours. Some people go in like once a week for the whole semester because they love it. Some people go in like once and they're like, yeah, it's not for me. Like it's kind of however much you want to put into it. But it's a really cool experience to get like right in the hospitals, right in clinical spaces like week one, and get that kind of mentorship aspect from a physician, especially if you're interested in that field. And kind of get shadowing, you can get volunteering, you can have advocacy like out of all those. So it's also a really cool experience.
Yeah, thank you for that. And just to clarify, the Explore program is part of the curriculum, but you have that freedom to choose maybe what area you're interested in, like Morgan mentioned. Thank you. I appreciate that. And I always love hearing from the preclinical students because they do this every day. So they are the most knowledgeable about how that curriculum works. Speaking of curriculum, any questions about the first 2 years of the Rush curriculum? And feel free to unmute or put it in the chat. It's up to you. Okay, if people are typing, that's fine. I'll move on to talk about the clerkship curriculum, and we can always circle back if people put any questions in the chat. But your 3rd and 4th years are the clerkship years or the clinical years. So the rotations that are listed here are going to be the clinical rotations that are required that you complete. All of the rotations that are listed here, except emergency medicine, are going to be completed in your 3rd year. Emergency medicine's in your 4th year, and that's because emergency medicine, you're not quite sure what a patient case is going to be, so you have to have the knowledge of all the other rotations before you do emergency medicine, so you can be prepared to help treat that patient. We also have the opportunity for you to do elective rotations in your 4th year, and that's 28 weeks of elective rotations, and 12 of those weeks are at institutions other than Rush or Rush partners. And so if you, for example, if you're from Maryland and you want to go back to Maryland and do some rotations there, you can, or you can do rotations maybe in sunny California to escape the Midwest snow. We got snow today, and it's not even Thanksgiving. So whatever you want to do, you can do 12 weeks of rotations at other institutions. And those rotations can be in anything that you want. So if you're wanting to do more rotations in what you're interested in matching into, you can, or if you want to do a rotation in something that you might not ever have the opportunity to do again, you can do that. It's up to you. Could you do elective rotations abroad? So we do have a global health program, and that would be something that you complete during your 4th year. I will find the link for that, and I can put it in the chat later. But also, if you Google Rush Medical College Global Health M4 elective, it'll pop up, and again, I can link that later. It isn't going to be anywhere that you want to go in the world. It is limited to what options are available to you that year, but that is the main way that people are able to do global elective rotations in your 4th year. Yeah, Morgan, go ahead.
Yeah, we also have a global health program at Rush that establishes primary care clinics in the Dominican Republic and Haiti. And they also do surgery trips down there. So there's like 11 or 12 different weeks out of the year where there's a trip going. So there's a lot of the students in my class and upper classes will do, if they're interested in surgery, they'll go on one of the surgery trips, or you can go with the primary care teams when they go down to like set up and train and teach community members in the Dominican Republic while they're setting up those clinics. So those are also ways that you can do that.
Great. Yeah, thank you. And thank you, Audrey, for sending that link in the chat. I appreciate it. So yeah, that's the best way to do it. And that's usually going to be in the M4 year. Like Morgan said, you can get involved earlier, but if you want to do actual rotations, that'll be in your M4 year. What kind of direct clinical opportunities are available for preclinical year? Okay, so we talked about the Explore program. That's going to be the primary way that you can get involved as a preclinical student in the clinic. But I'll let our medical students answer if they had an additional way that they got involved in the clinic other than as part of the curriculum.
Yeah, there's a lot of community service opportunities that have to do with a lot of clinical care. I'm volunteering on Wednesday at the Haymarket Clinic, which is a nonprofit serving the West Side as a substance abuse program, and I'll be doing patient intakes and kind of getting hands-on clinical experience there. And also any faculty at Rush, if you email them or if you talk to them, they will be more than happy to let you shadow. There's so many opportunities to just learn more about different specialties. So even if you don't get something or you want to explore a different specialty, there's always so many resources for you to seek that out.
Morgan, did you have something to add?
Oh, nope, that's pretty much how I did it too. It's not like undergrad where you like have to like fight to find someone. If you have the med school email, they pretty much will let you come whenever. They'll just send you their schedule and say show up whenever. So it's very easy to get shadowing here at Cook County, like she's about to talk about, and like any of the primary care clinics or anything else around the city at Rush.
Yes, thank you. And I move forward in this slide to reemphasize what Audrey and Morgan had just mentioned, specifically their comments about how open folks at Rush are to medical students. So that is because we are a private academic medical hospital. And so we not only have a medical school as part of Rush University, but we also have a College of Health Sciences and a nursing college as well. So there are a lot of students learning at any given time at Rush. And so our faculty and staff at the hospital or healthcare professionals, whether they be physicians or nurses or PAs, whoever it is, they understand that yes, patients are their priority, but also that students and education is also one of their priorities as well. So you're not going to be a medical student who's forced to stand in the corner or is excluded from anything. You are going to be involved during your rotations. And even if you're preclinical and you're doing Explore, like you're going to be involved. Of course, you're not a resident yet. You can't do everything, but they are going to make sure that you're doing that hands-on learning piece. And then we also have, which Morgan already mentioned briefly, we also have rotations at the John H. Stroger Jr. Hospital of Cook County. And so Cook County, as it's often referred to as, is just a few blocks away from Rush, so pretty convenient. And it is a public safety net hospital. And so for those of you who are unfamiliar with the term safety net hospital, it is a hospital that sees a lot of uninsured and underinsured folks who can't afford maybe to go to anywhere else. And so they won't be turned away at Cook County because it is a safety net hospital. And so it also has one of the largest level 1 trauma centers. And so you see the difference when you're doing rotations in your M3 year specifically. You see the difference between working at a private academic hospital versus doing rotations at a public safety net hospital as well. So a lot of the patients are going to be from the west side of Chicago, but that main difference is going to be in insurance level and also disease progression as well. Because if you're uninsured or underinsured, you might not be able to afford to see a primary care physician every year. And so it might be the case where as a patient is coming in because they have no other option but to seek care. And so a lot of our students have talked about the privilege of learning from patients at both hospitals and also seeing the difference in terms of the environment. Before we move on, current medical students, I know you haven't started your rotations yet, but if anyone wanted to add anything about the clinical sites, because I know you have done Explore, feel free to do that now. But if not, it's also okay.
Yeah, I've done all of my explores at the Rush main site hospital, but I have gone out to the orthopedic hospital out in Oak Brook a couple times, and it's very similar. I have not yet been able to go to Cook County, but you can kind of have a choice of how many of your rotations you want to do at Rush or Cook County. So I'm looking forward to that.
Yeah, same here as well, but I do know that Cook County Hospital is quite literally steps away from your classes. So it's really easy to get to, and they're quite literally like connected. They're very close together.
Yeah, we're in the Illinois Medical District, so there's a lot of different hospitals within walking distance of each other. So thank you both for adding that. And to build on Morgan's point, these are the main two locations, but we also have satellite locations and other Rush hospitals in the suburbs, like Morgan mentioned, that you can also do rotations at as well. So any questions? If there are any questions, feel free to put them in the chat and we can answer them throughout as well. But believe it or not, your time as a student is not only going to be in the classroom or doing rotations, you have the opportunity to get involved elsewhere. Audrey already briefly talked about her involvement in one of our Rush Community Service Initiative programs, or RCSIPs as we refer to them as. And so if actually in the chat, if while we're talking a little bit about RCSIP, if you all who are involved in the community, if you could share maybe what your community service involvement is, either currently or in the past, because chances are that you can continue that passion and commitment at Rush as well. So our Rush Community Service Initiative programs they were started by medical students. They're often led by medical students. A lot of them do include nursing students and health sciences students as well, but they are mostly student run. And the group that Audrey talked about is going to be in one of the pillars called patient care. And so we do have free clinic opportunities for people to get involved in the community. But there are other ways to serve the community outside of just the clinic, although that is an important piece. So if you're passionate about food insecurity, you might do outreach, or health education and promotion is a big one because it's hard to know how to be healthy if you're not taught how to be healthy. So like, for example, we have a program called 5 + 1 = 20. And the whole idea is that there are 5 chronic illnesses on the west side of Chicago. And if you could teach one person about those 5 chronic illnesses, we can decrease that 20-year life expectancy gap, which again, Dr. Rich mentioned is now 14. But that's often teaching high schoolers, and then they teach their families, and then so on and so on. So that's a little bit about health education and promotion. That's just one example. Again, there are like over 40 RCSIPs, and they're not even all listed on our website because new ones are being founded all the time because they're based off of the needs in the community, and those are changing. And we also have promoting careers in healthcare. So if you're passionate about teaching kids that they also could be in medicine one day, for example, we have a group called Mini Medical School where 4th and 5th and 6th graders come to our campus and learn about anatomy and medicine and all those good things. And so they can know that that's an opportunity for them in the future if they want to pursue it. But that's a little bit about us. I don't think anyone mentioned any community service opportunities. Okay, here we go. Medical translator. Okay, great. Awesome. Okay, so that's more of like in the clinic opportunities. But I just want to thank you for sharing that. Education on childhood obesity. Okay, great. So there's a lot of different ways you can get involved, as we see it just in the chat. Like, some are clinical and some are non-clinical. And so sometimes there are different areas of the community that need help. And so for us, service can be clinical, but it also can be non-clinical. So I always recommend you follow your passions in the community, and then it feels like you're doing what you love. You're not just checking a box, but you're gaining experience at the same time. And chances are that you will have the opportunity to continue that passion at Rush in some way. Access to mental and reproductive health. Awesome. Great. So there are so many opportunities to get involved in Rush Community Service Initiative programs. I also mentioned that our medical students, almost all of them are involved in a RCSIP in one way or another. And so we really are looking for applicants who also share that love and commitment for the community, because our medical students are so involved, and we also have that as a large part of our mission as well. So I know, Audrey, you talked briefly about a group you're involved in. Morgan, do you want to talk briefly about a group that you are involved in?
Yeah, sure. I'm involved in a couple, as I think a lot of med students are, but my main one, the one that I'm a steer for, is it's called Medical Mobile Van. So it's kind of similar to the Haymarket Clinic. Our goal is in harm reduction. So we work with the Chicago Recovery Alliance, which is a nonprofit like 6 minutes away from the school. And they, like, our students come and build harm reduction kits. We have like wound care kits and those kind of things. And then we go out on the van with members of their team that are basically just promoting harm reduction, like safe needle exchange, like wound care. So our students will be doing wound care. We go out with either a PA or a doctor from Rush. So it's a really cool way to see new parts of the community, and they go back to the same locations every week and get to interact with members of the community. And their whole mission is not to we're not just pushing people towards, oh, here's these abstinence programs, here's what you need to do. Like this, we're not counseling anyone. It's literally, we have resources if they are interested in that, but it's literally just to help improve community relations with the medical care system and a lot of people that may not trust the medical system quite as much. So kind of always being there and being available for any help that might be needed is kind of really important.
All right. Thank you, Morgan. And again, like Morgan mentioned, they're both Audrey and Morgan most likely are involved in multiple things. And so if we have time at the end and people are curious, we can have them talk about their other involvement as well. But for time's sake, I just want to make sure that we get to all the main parts of the presentation. And I do see that there's a question in the chat. Once we talk about the next slide, we will do that question before we move on. So I see it, don't worry. Okay. We also have affinity groups. These are often formed around a shared identity or value, but they're not exclusive. They are all inclusive of all identities. And so we do have different ways for you to get involved. These are mostly run by medical students. And so it's a good way for you to network with other medical students. But also, believe it or not, a lot of these groups are also going out into the community as part of their work. And so the group pictured here is the Student National Medical Association, who every Martin Luther King Day, they run a citywide day of service. The Asian Pacific American Medical Student Association will go out into Chinatown. Latinx Medical Student Association will go out into Pilsen, which is a historically Latinx neighborhood on the west side of Chicago. So a lot of these groups are also doing community work as well as networking and going to conferences with each other. And again, I'll have our medical students talk about their involvement in affinity groups at the end if that's something that we are interested in. Okay, so the question in the chat is, what are the academic and emotional support systems like at Rush? And I want our medical students to answer that question since they might have used those resources.
Yeah, for sure. I think, or Morgan, I can touch about the emotional support systems, but Rush, I think, does an amazing job in providing these resources, especially through free therapy. I think that's a huge part of Rush that I was really impressed by because, having access to a free therapist is huge. Also, just so much wellness talks, and there's a service dog who comes around and has events sometimes. So there's like so much fun wellness things that Rush definitely does to support. And I think one of the biggest for me is just having access to that. And yeah, Morgan, if you wanted to talk about any academic support systems.
Yeah, so our school does a great job at kind of providing resources to get you through. We're in the second years are in our step studying we're starting to study for our step 1 right now. So it's kind of a lot, and it's during undergrad, you're thrown in, you have to study for the MCAT while you're doing classes. And unless you sign up for expensive programs, you're usually studying by yourself and figuring it out. So Rush does a great job of here's the resources that they give you. Okay, they're walking you through how to use them. Here's these weekly meetings with our discipline directors that explain certain topics. They have all of these things, as well as for just normal classroom besides STEP. All of the discipline directors who are the PhDs in pathology and biochem, all of those professors have office hours almost every week. So you can go to their office hours. They're always available by email as well. Also, we have older students will put on events before 2 to 3 days before every exam that are review events. So you can ask them, oh, what about this? Is this a heavy topic in this unit, or things like that. And then, I mean, there's way more than this, but just there's also these advising groups. So you have 20 people in your class that are in your group. You have 2 physicians from Rush that lead your group. So you have meetings with them once a semester, but you can also schedule meetings with them whenever. and they're just checking in on like, hey, how are you doing as a person? Like, I don't care really about your grades. Like, how are you? How are you doing? And kind of prioritize your health, your mental health that way. So there's always people checking in on you, even though it feels redundant. It's very nice, especially for those students who might really need that.
All right, great. Thank you both. And to build on the free therapy, we also have a free gym for students too. So if you like to let off steam in the gym, you can do that as well. But yeah, great question. Thank you for that. I also added a link in the chat. If you missed the QR code at the beginning, I know some people joined a little bit later. If you want to sign in, that would be great. And you can click that link to sign in if you missed the QR code. So I just wanted to throw that out there as we move forward. But, and again, feel free to throw questions in the chat if you have them throughout the presentation. Before we talk about the application process, I want to talk about ways that you can get involved as a pre-med, if that is something that you want to do at Rush. So a couple ways to do that. The first is a application workshop called Before You Apply. And this workshop is going to focus on application preparation. So what's the difference between a primary and a secondary application? What should I include in a personal statement? How am I supposed to organize my experiences section? All of that, every single piece of the application is something that we would discuss during this workshop. And it is for people who, because it is so application prep focused, it is for people who are closer to applying. So this usually happens the first 3 Saturdays of March, if not the last Saturday, February 1st, 2 of March. It kind of depends on the year. We'll release those dates soon. But it is for people who are applying the upcoming cycle. So if this is in March, you're planning on applying a couple months later in May when it opens up, or the next following May. So within a year, basically, of applying is when you would be eligible for this program. And the application opens in the winter, usually December or January. That link I shared in the chat, we have your contact information. I'll send you a follow-up email later this week, but also if you're planning on applying to the upcoming cycle, I also will send an email to you saying that this application opened if you're interested in applying. So just keep that in mind. I promise I won't spam you. I only reserve the emails for the most important updates. So that's a little bit of information about the application prep workshop. If you're a little bit further away from applying, I know we had a few people in the chat who said that they were earlier on in their time at Johns Hopkins, then you have the opportunity to apply to the David Jones Peck MD Pre-Medical Education Program, which is somewhat of a mouthful, which is why we call it the DJP PEP. But this is an in-person program as opposed to the virtual workshop that we just discussed. So this is an in-person program that's in the summer. So in June and July, it's a 6-week program. The difference between the programs primarily is going to be that this program focuses on academic enrichment. So during your time in this program, you'd be taking classes in the basic sciences with a focus on health disparities. So if you're someone who needs like an idea of what the medical school curriculum is like and needs to know how they need to prepare their application in the next few years before they apply, this is a good workshop, or excuse me, a program for you. Please note that you have to be a junior, a senior, or a undergraduate, like someone who has finished their undergraduate degree, excuse me. Like if you're in a gap year or something like that, and you can't be applying in the upcoming cycle. So that's a little bit different from the previous workshop. And again, this application will open early spring. So these are the major differences between those programs. So for the application workshop, it would be, if you're applying the upcoming cycle, it's going to be focused on application preparation. It's going to be virtual in the spring. DJP PEP is for if you're a junior, a senior, or have graduated from an undergrad program, you're at least a year away from applying, you want to focus on academic enrichment, and it's in person this summer. We do provide housing and a stipend for you as well. So just keep that in mind. Any questions about these 2 programs? We also have people from across the country who do both of these programs, so you don't need to be local to Chicago. We actually had a Johns Hopkins student in our previous DJP program, so we welcome people from everywhere. Okay, great. Well, we'll go ahead and move on and talk briefly about applying to Rush. So I know some of you said that you're already in this, so maybe this isn't as relevant to you, but if you're excited about Rush, we really align with the type of medical school that you're interested in applying to. Great, but now what? What do you do between now and the time that you would apply? So I just want to talk a little bit about how we review applications. So we do use holistic review, which basically means that we're looking at the whole application, the whole applicant. So everything is in context. We're looking at the entire application. We use this chart, which is from the AAMC, or the Association of American Medical Colleges. It's called the Experiences, Attributes, and Metrics model. So as you can see, there's a few concentric circles here. So metrics is in the middle. It is foundational to your preparation for medical school, but you are not just your MCAT, you are not just your GPA, you're much more than that, as you can see in this chart. So we already talked about a community service commitment. We also have patient care in here, which is also important to us. Research is in here. So if you are someone who's passionate about research, there are many research opportunities at Rush. We don't require it as part of your application, but we still want to know that about you if it's something that you're involved and interested in, because it tells us a little bit about what you're passionate about outside of just what's required of you for our application, for example. There's also different things like life experiences and distance traveled. Everyone's journey to medicine is different. Maybe you're coming straight from undergrad, maybe you're taking a few gap years, maybe you're taking 20 gap years and you decide you want to be a physician later in life. Everyone's journey is different, and we want to know about your journey and how you got to deciding that this was the career for you. So we have, this is a similar chart, but just to put it into perspective of the different chunks, the experiences, metrics, and attributes. And then all of that is within life context. So everyone's journey is different, as I mentioned. And then in the middle, you see mission alignment, right? That is important. I would recommend not applying to a school if you don't align with what they're wanting. So if you hate research, maybe don't apply to a research-based institution. If you wouldn't consider actually going to that school if you got in, then maybe it isn't the school for you, and that's okay. But for us, we're looking for people who are interested in that direct patient care aspect, that community service aspect, and that's what is a mission alignment for us. So. Okay, so I know this is always what everyone wants to know. Okay, what about the basics? What do I need to get done? Understandable. So we have some attributes of a successful applicant. The first one is going to be your academic foundation. So all of the coursework that's listed here is also on our website, so don't feel like you have to memorize any of this, and it'll also be in that email I send you later this week when I link to different resources. But there are different classes that are required of you, and all the classes that are listed here, please keep in mind that they need to be complete at the time of application. So by the time you apply, you've completed all of these classes. So for example, if you're graduating or if you're applying to medical school at the end of your junior year, it can't be, oh, well, I haven't taken a math class yet, I'm planning on taking it during my senior year. You cannot move forward in our process if you haven't already taken that class. So hopefully that is helpful. But we also have some academic metrics. We have something called a metrics matrix. So there's kind of a balance there. We understand maybe sometimes you have a bad semester, or maybe you aren't the most confident standardized test taker. Maybe you were kind of not feeling super well the day you took the MCAT, or whatever it is. There's a balance here between GPA and MCAT. Because we understand that those things happen. And so the lowest GPA we'd accept is a 2.99 cumulative undergraduate GPA, but you need to have a 510 at least on the MCAT. And then the lowest MCAT score we'd accept is a 500, but you have to have at least a 3.8 cumulative undergraduate GPA. So those are the undergraduate metrics. I know that a few people mentioned at the beginning that you were in the post-bac program at Johns Hopkins. And if you are in a post-bac program, there are different metrics you can use. So if you're in a post-bac and you've completed 24 hours by the time you apply, you have at least a 3.5 science GPA and a 503 in the MCAT, then you can qualify for our secondary as well. So as long as you fall into one of those buckets, undergraduate or post-bac or / master's, then you can use that. Something to be aware of is if you aren't in a science-based post-bac, and instead you want to pursue like a master's of public health or a master's of business administration, like if you want to work in hospital administration someday or you're passionate about public health, I'm not going to tell you not to pursue those degrees if it's aligned with your personal goals and your journey to medicine, but do keep in mind that we're looking for the science GPA for post-bac. So if you are going to a master's or a post-bac specifically for the metrics, then it needs to be a science-based master's or post-bac because we're looking at the science GPA, whereas undergrad, we can get anyone from any major because it's a cumulative GPA. So hopefully that helps a bit. But yeah, if you have any questions, don't feel like you're interrupting me by putting it in the chat. I'm happy to answer any questions you have. I did also mention that you are not just your GPA, you are not just your MCAT, and I mean that. There are other things, other aspects of your application that we're looking at. So feel free, again, to put in the chat. I know I already asked you about your community involvement, but if any of you are working with patients currently or have in the past, feel free to share the ways that you're doing that as well in the chat. I always just am interested to see how pre-meds are getting involved and what their passions are. So feel free to share that. But we already talked a little bit, as I mentioned, about service to the community. And again, this can be clinical, but it also can be non-clinical. And so every community has needs, and so working to help address those needs is important. So service to the community, again, doing what you're passionate about. Are you passionate about, food insecurity? Are you passionate about domestic violence prevention? Are you passionate about immigrant health? Whatever it is, following your passions is a good way to go because then you're doing what you love, but you're also gaining experience at the same time, not just checking a box. So service to the community is important to us. And again, that's just because it's such a big part of our mission and a big part of our medical students' involvement. But then also we're looking for clinical experience, specifically direct patient exposure. So shadowing could be a good way for you to understand what a physician does and to know that you want to do that too. But for our purposes and our application at Rush, that won't count towards your direct patient experience, which is what we're primarily looking at. So direct patient exposure is anything where you're working directly with the patient, is what it sounds like. So being a medical assistant or a CNA or a phlebotomist or EMT or whatever it is that you're working directly with patients, that's what we want to know. And that's because that is not only a big part of our mission, but also, as our medical students mentioned, you could be working with patients as early as your M1 year at Rush. And so we want to know that you understand what it's like to work with patients because you'll be doing that as a physician in the future as well. We're also looking for communication and teamwork and leadership skills. Again, you don't need to be a pro by any means at any of these things, but we want to see that you have a foundation there. And you could show these skills through numbers 2 and 3, but also you probably have other involvement outside of that as well. Maybe you show leadership through your research projects, or maybe you show communication and teamwork because you're in a student organization. You can show these in many different ways. And the reason we're looking for these skills is because communication and teamwork is a big part of our curriculum. In the flipped classroom, you're going to be working with your classmates. You're going to be communicating with them. In your clinical years, you're working on a healthcare team, and then you might eventually lead a healthcare team as a physician. And so that's why we look for these aspects of the application as well. Any questions? I know I have 5 minutes, so I want to make sure we get to everything, but I also want to be sure that I'm not skipping over any questions. Okay, feel free to add them as we move on. Some other important requirements is we do require the CASPER exam, some letters of recommendation, and citizenship documentation as well. And you can scan this QR code. It's also on our website. So, okay, I want to briefly talk about the application timeline. Some of you, again, are in this right now, so you might be already aware. Does Rush accept letters of continued interest throughout the cycle? Yes, we do. Sorry. Okay. We do accept letters of interest. I would say, though, that don't feel like you have to submit like so many of them, right? Showing that you have interest is a good thing, but don't feel like you have to do it all the time. Like, for example, an update letter, we also accept update letters. I would say reserve update letters for things like maybe that weren't initially on your application. So if you got published or you presented research or you started a new position, then that's something that you could update us on, but don't feel like you have to update us on things that are already in your application. Similarly with a letter of interest, I would say once you submit that letter of interest, we've seen that you have that interest. So there's not a specific time in the cycle we require you. We don't require you to do it, but if you want to, you can upload that through your student portal, or excuse me, application portal. Okay, so I know some people, that was a current applicant question, so some of you are already in the cycle, which is great. Again, like I mentioned, so this might be something that you're already in, but if you haven't yet applied, this is a good idea of what the cycle looks like. So I keep skipping ahead. Okay, so this is the timeline. And I want to talk briefly about what these dates mean, but I also want to emphasize that if you could take away one piece of advice I give you today, it would be don't apply until you're ready. So when you're considering applying and you're gathering all the different aspects of your application, consider, okay, do I feel ready to apply to medical school? And if not, what do I need to address before I apply? Do I need to retake the MCAT? Should I go and do a post-bac? Do I want to work full-time with patients or do some more community service? Whatever it is, get it done before you apply, because we want you to be a successful applicant, which means that you're the most confident in your application that you can be. That's what we want for you. And then as soon as you know that I feel confident in my application, I'm happy with it, I'm proud of it, as soon as you know you're ready to apply, then apply as early in the cycle as you can. We do use rolling admissions. So the earlier we have your application, the earlier we can look at it. Because we can't look at your application until we have all the pieces of your application. So that's why the earlier the better. But we are throughout the cycle sending invitations for secondaries, interviews, accepting and waitlisting and denying folks. So again, it's rolling throughout the cycle. So that's why earlier the better, just so we can see it earlier. So the AMCAS application, which is the primary application, that opens on May 1st and it'll close October 1st. So that's the primary application that you send to all the medical schools that you're interested in applying to. Our secondary application opens in July and it closes in mid-November. So it actually closes soon, like in a couple days. And so that is going to be specific to Rush. So Rush is going to have a secondary that is about our school, whereas maybe you apply to 10 different schools and you hear back from 8 of them. Secondary is going to be a specific application for each of those schools. So you'd have like 8 different applications to fill out, for example. So, and then our interview season begins in September and then usually goes through end of February, early March. And that's a little bit about what's going on here in terms of the dates. So I saw a question in the chat real quick. How does Rush weigh service hours versus impact? For instance, if an applicant did an activity for 50 to 60 hours every year, but the activity was meaningful and had a tangible impact on the community. Okay, good question. A few things about not just service hours, but also, excuse me, not just service, but also direct patient exposure. We're looking at quality over quantity, and we're also looking at commitment over time. So a quality experience is something where you got a lot out of that experience. You were working directly with people. You're able to share what you learned about that experience. Everyone, their quality experiences are different depending on the person. But like, for example, you could be volunteering at a soup kitchen and maybe you're there for, millions of hours, but you're on your phone the whole time. That's probably not going to be an entirely quality experience, but maybe you volunteer once a week or every other week and you get to know the people who are visiting every week and you form those relationships. And so that's more of like a quality experience. And then similarly with direct patient care, that's why we don't really consider shadowing direct patient care, because it's more hands-off, it's more passive, rather than that quality experience that will be working one-on-one with patients. And then that commitment over time is, having involvement in a couple of things that you've done over the course of like a year or 2 or however long it is. Inevitably, some experiences are going to be short term, especially if it's just a summer or just a semester, but we just don't want all of your experiences to be those short term experiences. So hopefully that cleared up your question. And if not, I can always clarify if you have follow-up questions, but thank you for the question. Okay, so I talked about the timeline. Briefly, I know we're at 5:01 Central Time, so I know that it's like 6 o'clock where you guys are. application stats I want to show real quick, just because I want to re-emphasize why I say apply when you're ready, because applying to medical school can be emotional, it can be expensive, it can take up a lot of time. And so we want you to be confident in your application so that you can be a successful applicant, because Rush does get a lot of applications every year, and not that means it's impossible to get to Rush. We have two shining examples here of people who made it to Rush and are making it better, and helping the community and things like that while they're here. So it's not impossible, but just so that you know kind of what it looks like from an application end. We do typically interview between 450 to 500 people, and our class size is always 144. So that's some information. So when should you apply? In the chat, what did I say is the one piece of advice that you should take away today? When should you apply? When you're ready. Thank you, Elizabeth. Yes, when you're ready. Absolutely. Okay, great. So that's the end of the presentation. I know that we went a couple minutes over. I'm going to go to the beginning again, just in case people missed either the QR code or that link in the chat. So if you need to scan it, I'll have it up here just in case. Okay, great. So I know, again, like I mentioned, we went a few minutes over time, but if we have any questions, happy to answer them now. And again, you can put it in the chat or you can unmute. Or if there's anything you want to know from our current medical students that you didn't get to learn earlier. Oh, okay, we have a question. Oh no, it's just a thank you. Okay, thank you.
I had a quick question. Something that I'm always curious. Also, it's a great presentation, by the way. But
it's good.
Something I'm always curious about, especially as someone who's kind of coming from a little bit of a non-traditional path. I was just wondering, are there opportunities to do research outside of the, I guess, STEM sciences? I'm thinking like the social sciences or kind of adjacent fields like that. I was wondering if you had any knowledge on that.
Yeah, I do, but I will let our medical students answer first in case they've done it personally, and then I can build on that. But yeah, Audrey or Morgan, if you have specific examples of ways you've gotten involved similarly at Rush, feel free to share.
Yeah, so research is like a huge part of kind of what a lot of students do. Not all students do it, but a lot of students do. We have our summer research program like in the summer between M1 and M2. And so I think it was like 85 students participate in it. And it's like a paid research, kind of like mini internship for like 2 months. But it was, there's students doing projects on like cell membranes and like little tiny micro things, all the way to, like you were talking about, like social sciences, impacts on the community. Not for that project, but something I'm working on is when I was talking about the communities in the Dominican Republic, we were doing like interviewing families and individuals in the towns that we were going to, doing needs assessments. And so we were doing research off of their answers for that. So like there are even things like that. But there's kind of a wide range of almost everything. The Health Equity Institute does a lot of research specifically in those kind of social sciences. But you could find pretty much anything here. I know there's one of the orthopedic surgeons that does a lot of research in like cost reduction. And so there's things that you kind of never even think about, but it's like, he's like, oh, well, if we use this certain antibiotic or like we schedule something like this, the patients have to pay $200 more. Like, why is it like this? So they basically do deep dives into stuff like that, even to like kind of look at the impacts on patient care and stuff like that. So there's so much research going on, and it's like a really wide range of what you can look into.
Yeah, and kind of going off of that, I love psychiatry and psychology. So I got involved on a research project that's looking at women's mental health, and it is a little bit less medical and more, I guess, social. I know there's some classmates who are doing research on like gun violence and also having to do with the RICSIPs as well. I also personally love medical humanities, and I don't know if Sarah touched about the electives on your preclinical years, but we do have a medical humanities elective. Not so much research as of right now, but that is something that I do want to explore. And there's so many, like my professor for that class is a psychologist, so there's so many different ways to explore different avenues and kind of do different things outside of medicine, but also still relates to health. So yeah, I hope that answers your question.
Yeah, and to clarify, Morgan mentioned community health needs assessment in her work abroad, but we also do a community health needs assessment on the west side of Chicago as well. And students are sometimes involved in data for that, but they're especially involved in addressing those needs. And then Audrey kind of alluded to this, and Morgan as well. We also do have like a health equity and social justice leadership program that you can apply to once you've been accepted to Rush. And that would be like the main thing that you do in that program is going to be like a 4-year longitudinal project in the community throughout your time at Rush. And so that's usually going to be like hands-on in the community, and it could involve research, but like it's like you and the group of students you're working with choose a project. In the past, it's been like correctional health or gender affirming care, or I know that there was an M3 I talked to recently who is doing like cleft palate information like in other languages, because people don't really have access to all the different information for that in their native language. And so things like that that are more social sciences related. But yeah.
Thank you so much. That's awesome. Those are really cool things. Thank you.
Yeah. Thank you for your question, Anna. Any others? Don't think I missed any in the chat. Okay. Morgan also put her email in the chat, so if you do have any questions, oh, and Audrey too, if you have any questions for our students, you can always reach out after today and pick their brains if you'd like.
Great. I just wanted to say thank you again so much for coming out. Well, for hosting this today with us, as well as the 2 medical students who also joined. Audrey and Morgan, thank you so much for your perspective and insight. I think this has been very helpful. I am going to stop the recording now, but for anybody who's on the call, if you want to watch this again, we will put this on our YouTube page on the Hopkins Pre-Professional YouTube page. You can find that link on, you can Google that, and you can also find it on our website. So if you would like to watch again, or if you want to share with friends, you'll know where to find it.
Yeah, great. Well, thank you so much for having us. And just a heads up, if you didn't fill out that QR code, I'll probably send you an email tomorrow. So just by the end of the day today, that would be great. But I wanted to thank you all again and wish you the best on your journey to medicine. I know some of you are in the current cycle, so good luck. And if you even aren't in the current cycle, if you're planning on applying down the road, still wish you the best. And feel free to reach out to us if you have any questions. The email I send later this week will be from our main contact, so you can always reach out to us if you have questions. But yeah, thank you again so much for having us, and thank you to our medical students for joining as well.
Great, thank you.
Thank you. Bye.